Hello, everybody. Let's go ahead and get going with our lecture here. This one's going to be internal bleeding. It'll be a little short one. So we talked about external bleeding. Let's talk about internal bleeding. May result from trauma or medical problems. It's not always just a traumatic incident. It might be some sort of medical issue that's kind of leading to that leaking gut that happens to people sometimes. Internal bleeding may not be obvious and can rapidly result in death. So these are the types of things we really have to pay attention to because this happens quick, and we may not have advanced warning or signs and symptoms that really pop out at us. This is where we're looking at those signs of shock, and that's really what's going to help us identify bleeding sometimes. Common sources of internal bleeding are injured organs and fractured extremities. A hematoma is a contained collection of blood that contains a significant amount of blood. So if you've ever seen a hematoma, basically it's a bruise, but it's a lump that's pretty bruised up. Uh, Signs and symptoms to estimate severity of blood loss are things that we want to look at. Let me see, make sure that was what we had there. Okay, so um, yeah, we want to take a look at those signs and symptoms that are cluing us into the fact that this may be somebody going into shock because of internal bleeding. Things we're looking for. Part of that head to toe exam, doing the decap BTLS, we get to the abdomen, we get to that portion of the body where we're going to find some of our internal bleeding that is causing the problems. We're looking for that distended abdomen, rigid abdomen, guarding, pain and on tenderness, pain and tenderness on palpation kind of thing. Oops, sorry, hang on. All right. Assessment-based approach, perform a scene size-up, look for a mechanism of injury, form a general impression, immediately control major external bleeding, and pay close attention to the patient's status. Big things, again, ABCs, back to the normals. We want to make sure that we have those ABCs intact. That patient's mental status begins to change. The ABCs are going to start to decrease, and in that respect, we're going to have some change in life threats. Assess breathing and oxygenation. Assess the pulse, skin, capillary refill. You guys remember cap refill. You got your nail bed. You squeeze it, release it. Should return within 2 to 3 seconds. Book has some specifics as to age and how quickly it should return, but that's rough, quick estimate. Say we've got good distal circulation. Color disappears, color returns. Remember, nails that have paint on them, we can simply turn the hand over and do the opposite side. You can blanch anywhere on your skin and you should be able to see that color change. That's about circulation happening. Pay attention to change in the respiratory pulse and skin that can indicate blood loss. Pale, cool, diaphoretic, rapid, increased pulse out of really nowhere, and increased respiratory effort because we're lacking the circulation, we're lacking oxygenation throughout the body. The body's only recourse when we can't get enough around is to speed up. And that's the initial stage of shock, right? Everything begins to step it up a little bit, increasing. Blood pressure maintains its normal. And then eventually, blood pressure begins to tank. And then we start to lose those pulses and respiration. They start to decrease as well. Worst case scenario. Perform a rapid secondary assessment if the mechanism of injury and assessment suggest internal bleeding. Head to toe exam. So you're going to be doing your assessment from head to toe, looking for all the injuries in between. I'm probably going to ask you guys here pretty soon to start doing some assignments at home, videotaping yourselves, going through these assessments, medical trauma assessments from head to toe exams. I think it'd be a good opportunity for us to practice that skill again. Okay, look for external indications that there is an internal bleeding. Contusions or bruising, we understand what these are. Abrasions tell us that we've had some sort of traumatic injury at this area. May not be real bad, but maybe enough to say there's some sort of bleeding underneath. Deformities in an extremity, impact marks, and swelling. Any kind of swelling, obviously, it's going to tell us there's bleeding going on underneath. Signs and symptoms of internal bleeding: pain, tenderness, swelling, discoloration. On those assessments from head to toe, identifying the pain, tenderness on palpation, looking for swelling, seeing swelling, feeling swelling, and discoloration is that ecchymosis or bruising. Bleeding from a bodily orifice. Maybe you've urinated blood, defecated blood. You may be bleeding from your ears or nose, which is indicative of a head injury, skull fracture. Maybe you're actually vomiting, bright red or coffee ground emesis. So again, to review, bright red tells us it's actively bleeding close to the exit now. Okay. Coffee ground means it's been bleeding for a period of time and it's been digested partly, and that's what we're removing is digested blood. Between the two, both are bad. Coffee ground is the worst case scenario. Dark tarry stools, bright red blood, same thing exists here. Dark and tarry, it's been digested for a long period of time. It's a bad situation. Bright red, it's happening actively close to the exit. Tender, rigid, or distended abdomen, palpating, four quadrants, making sure we're touching the four quadrants properly. If the person's conscious and awake, does something hurt before I touch? If not, then you go through and you're identifying they're soft and supple. We want to be able to push into each area of that abdomen. If I can't push in, if it feels rigid, and the person is not, the person is either guarding or there is swelling going on that's causing that problem. Signs and symptoms of hemorrhagic shock, anxiety, restlessness, combativeness, altered mental status, weakness, faintness, dizziness, and thirst. And remember, in shock, nobody ever receives any fluids or food by mouth during this process because it's going to be a bad situation. If we give them something, they become sick, nauseous, throwing up. Signs of shock, hemorrhagic, this is bleeding again, shallow, rapid breathing, thirst, shallow, rapid breathing. We got that twice. I don't know why that's there twice. I'll fix that. And rapid, thready pulse. Rapid meaning fast, quick. Thready meaning I can't explain it other than when you're feeling the radial pulse. When you feel that radial pulse or the carotid pulse, whatever pulse you're feeling, there's almost like this space missing in between. You feel the blood flowing by, but you can feel the space in between it. There's something missing. It's a hard thing to understand until you actually feel it. Pale, cool, clammy skins, we'll be looking for delayed cap refill. That's the fingernail, bed squeeze, and release. Narrowed pulse pressures. We're going to talk about that another time. We're going to kind of delve into that a little bit. Dropping blood pressures, dilated, sluggish pupils, and nausea, vomiting are things we're going to see. Emergency medical care. For this, I think I'm going to stop here, guys. Oh, no, excuse me. Internal bleeding. We're still there. Emergency medical care. My bad. Use standard precautions, maintain an open airway and adequate breathing, administer oxygen if there are signs of poor perfusion, or to maintain an SpO2 of 94 or above. And again, back to the basics. If we're looking at pulse ox, which we don't look at here in California, but we should understand them. And if they are being used and we see anything below 94%, then we need to provide O2. Control external bleeding, provide immediate transport, treat for shock, and go back over the assessment. Once we've got them in, we're going to look over those things that were interventions we needed to put in place. The bleed control is still happening, or we had a fractured extremity that was bleeding internally. We splinted it. Is that now slowing the bleed? Is the bruising getting worse? Is the swelling getting worse? Should we add ice packs? It's reassessing, going back over all these different things to double check and make sure things are working right. Okay. All right, guys. I'm going to stop there. I know this is really odd and weird. I apologize. I wish that things were moving differently for us. But I think we're doing well. We're covering a lot of material here, and if you guys have any insight, anything you'd like to discuss, please send me some emails so we can talk about it a little bit and try and figure out some different directions we can go. I'm trying something a little bit different with our weekly meetings that we'll be having. We'll be talking about that on Tuesday. So just so you guys know, okay? Thanks very much. Stay safe and talk to you soon.